But it is good to realize that you can change those habits to healthier habits and have improvement. It's empowering, right?
Welcome to Discovering Nutrition with Cronometer. I'm your host and community marketing manager, Elisa, and today I am thrilled to sit down with our special guest, Dr. Tracy Paeschke. Dr. Paeschke is a preventative cardiologist. She uses her expertise of over 25 years in cardiology to help people with high cholesterol, a family history of heart disease, or other cardiac risk factors, and those recovering from heart conditions. She also offers personalized, in-depth consultations and integrated strategies to manage risks and improve people's health. In this episode, we sit down with Dr. Paeschke to discuss heart disease, why you should start paying attention to your heart health right now, and a comprehensive action plan that factors in exercise, diet, and lifestyle to keep your ticker ticking. As always, this podcast is for general purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including getting medical advice. The use of information from this podcast is at the user's own risk and is not to be substituted for professional medical advice, diagnosis, or treatment. Heart health is something that is near and dear to my own heart, pun intended, and I can't wait to dive in. Please introduce yourself. Tell us a little bit about you and how you got into preventative cardiology.
Yep. So I'm Dr. Tracy Paeschke, and my practice is heart health prevention and wellness. And I have an office in Monument, Colorado, and I see people online as well through telehealth. So I've been a cardiologist for 25 years, and I've spent most of my career taking care of people after they have heart attacks or an arrhythmia or a heart failure. And I decided after seeing that for so long, I decided to change my focus to try to help people prevent from having those problems in the first place. So help people work on prevention to prevent heart attacks, prevent heart failure, prevent arrhythmias, so they don't have to deal with the consequences, right? Help them stay healthy and prevent heart disease. So that's my focus now, is on prevention. So people who have maybe a high cholesterol or a family history of heart disease or some other cardiac risk factor, or people who've already had a cardiac event and are trying to figure out how to avoid another one, that's where I come in. So I provide in-depth consultations to help people figure out how to modify those risk factors and prevent disease and age in good health. So that's my focus now.
What age do you typically start seeing people? Like, what is the best age for someone to start working on preventing the possibility of a cardiac event? Is it in childhood or, what is the best time realistically, we'll say, as an adult to start focusing on this?
Well, so in my practice, I see typically middle-aged adults, so people from, say, 30s to 60s, because that's when people are more focused on their health, maybe. Maybe they know somebody that's had a problem, or they had a weird symptom and they're worried. So that's typically the age when people start being more concerned about their health. But believe it or not, they've studied even children can have what we call fatty streaks, which are the first signs of atherosclerosis or precursor to plaque, right? Which just reminds us that we can't, it is a lifelong process, right? So people that develop heart problems, typically they've been accumulating risk factors for 50 years, let's say, right? And then suddenly something happens, but the process started a long time before that. So that's good news though, right? So we can help people change those risk factors again, so they don't end up having the heart problems. So I would say the earlier we can start, the better. And the other thing to remember is that people's health habits and life habits start as kids, right? So people eat what their parents eat, and they do the same thing their parents do, right? So if your parents smoke, your chance of the children smoking is much greater. And it's the same thing with food and activity, right? We tend to mirror our parents. So sometimes it's not so much that we get bad genes from our parents, but sometimes it's the bad health habits, right? So the earlier we can start with that, the better we'll be. The easier it will be to live a healthy life.
I don't know if many people are really thinking about their children's heart health.
No.
But I hope that most people are. You know, we look at things like, I know childhood obesity is on the rise, and obviously that would probably, I'm making the assumption, would have implications on cardiovascular disease and that kind of thing. But I don't really think that most people are like, oh, you know, I should do these heart healthy things for my child, because it's just, we just don't hear about it as much. Obviously, we do hear about it more in middle age. But if we could talk about some of the risk factors, I think you've touched on some of them. What would the most common risk factors for cardiovascular disease be that you see in your practice?
Right. So risk factors for heart disease are things like high blood pressure, high cholesterol, diabetes, obesity. But if you take a step back from that, so go back even more. So those are considered the traditional risk factors for cardiovascular disease. But let's look at what causes those things, right? So if we look at things like high blood pressure, high cholesterol, diabetes, obesity, those things are often caused by lifestyle things, right? So contributions, diet can cause those things. Lack of exercise, or smoking, or alcohol, or other what we call risky substances, right? Stress, lack of social connection. So there's a correlation with loneliness and depression and cardiovascular disease. So I think it's more helpful to not look at the risk factors like high blood pressure and diabetes and high cholesterol, but go back a step further. What are the risk factors for getting those things, right? Because it's actually easier to attack all the things that cause those other things, because that has long-term implications for your health in other ways. In other words, if we follow a healthy diet and we are more active and we have more restorative sleep and we avoid those risky substances and we have a strong social connection and we practice self-care for stress management, we won't have as much high blood pressure and diabetes and obesity, which means we won't have as much heart disease. We also won't have as much cancer and as much Alzheimer's and as much autoimmune disease. So see, it's all related. Those same healthy lifestyle things for heart disease also prevent all those other diseases too. So it's the most effective way to prevent everything, right?
Do you think that there's merit in people who have, either consumed alcohol regularly, or people that smoke, or people that are sedentary? Do you think that it's from the approach that it's never too late, or is a certain amount of damage like basically done? Because I know a lot of people, they have these habits and like, well, I've been doing this already for 10 years. So the damage is done. Is that true? Or can we reverse some of those lifestyle factors?
Yeah, it's never too late. They've even studied people in their 80s and older. Lifestyle changes have positive effects no matter what your age and no matter how long. They've done those studies too. When people stop smoking, their arteries are better within a few hours, and their heart slowly, over a year or two, improves, and their lung function improves. So it's never too late. No, it's never too late. Which again, and that's the good news, right?
It is great news.
Yeah. So that empowers people, because like you mentioned before, sometimes when you're young, we don't think about that stuff when we're younger, and we do all sorts of stuff, and we just keep doing those bad things, and we don't think about it much. But it is good to realize that you can change those habits to healthier habits and have improvement. It's empowering, right?
It is. One of the things that I find really interesting about people wearing activity trackers and wearables and that kind of thing is, well, they're not 100% accurate. And we know that. I actually did a great interview with someone who does third-party testing. And he was talking about just, there's a margin of error. But one of the things that I think is so great is people are more aware.
Right.
And I was talking to a couple women who wear the Oura ring. I'm not sure if you've heard about Oura, but they were saying that they noticed their resting heart rate during sleep was significantly higher on days they consumed alcohol. And I was like, does that change your behavior? Because for a lot of people, alcohol is something that people genuinely enjoy. It's social, or they love a glass of wine or a couple beers, and they don't really think about it. But then when the evidence is there and it's plain as day, then I'm like, are you more likely to make changes? And they said yes. And I was like, that's incredible to me, because this is feedback we wouldn't have had from our bodies 10 years ago to understand those things. So I think that that's amazing. I actually track my own. I'm curious, do you track your heart rate or anything?
Not with a wearable. I've done the glucose monitor for 2 weeks, which I thought was really helpful to see how, right, because it makes it more personal when you're tracking your own stuff, right? It makes it more personal about how things affect me. So like with the glucose monitor, when I eat certain foods, how's it affecting my blood sugar, and things that I thought were, quote, healthy, where I was seeing spikes, right? So it just helps you, maybe for me, then I need to make another change, right? So it's awesome, to use that information. And, regarding the heart, there's some the Apple Watch can give you great recordings of your heart. So, it's great that we have those technologies.
Yeah, I think that it's really empowering and helps us make great decisions, and honestly can show us some trends and that kind of thing. That's I wear an Apple Watch. I've worn the Oura Ring. For me, I like looking at the trends as opposed to like what is happening like day to day, because that gives me a better idea. And I've learned a ton about my own heart, I think, and recovery and that kind of thing, which I'm going to ask you a couple questions later, because I do have a couple questions. But one of the questions I did have, because people are listening to this and they're like, okay, I can obviously drink less alcohol, I can exercise more, I can clean up my diet, that kind of thing. But how do people know about where they sit for some of those other risk factors? And what is the process you think people should go about finding out their cholesterol, their blood pressure? Like, if someone is 45 right now listening to this and they're like, I actually don't know any of these numbers, what should they be doing? Should they at that age, be going out and getting tested for those things?
Well, I would say that your 40s would be about the age when you need to start establish care with a good primary care physician. Right. And they'll check your blood pressure, and they'll send you for lipids. You have some other preventive screening that starts, they've lowered the start colorectal screening at 45 now. So that's around your 40s, you should start paying attention more to these numbers. Because like you said, it's something you can track over time. Right. And you don't want to, you don't want to have high blood pressure, let's say, and not know you have it, because then you can't do anything about it, right? If you don't know. So you can't kind of stick your head in the sand with this stuff, right? You have to be aware of these things, because you won't be able to make healthy changes if you're not aware it's a problem, right?
Yeah, I completely agree. Knowledge is power. I
That's right.
remember I was in my mid-20s and I asked if I could get my cholesterol tested. And my doctor was like, well, why would we do that? You're 26 years old. And then didn't do it for me. And then I ended up going to another physician who did do it for me, which I thought was great. And then she was actually like, your cholesterol is out of whack. And I think I had low good cholesterol. If that's, do you still categorize them as like good and bad cholesterol? Mm-hmm. And then, so
Yeah.
she made a recommendation, I hope it's accurate at the time, to just have like incorporate some more healthy fats into my diet and that kind of thing.
Right.
And I remember thinking even at that age, I was like, had I not known about this and I just continued doing what I was doing, how many years would I have been, missing something that could long-term affect my health? So even though it felt very premature, I think to my regular general practitioner, it ended up being something that I caught and was able to make an actionable change. And hopefully like 10 years later, it's serving me well, so.
Right. And that's the whole thing about prevention, right?
Mm-hmm.
And this is a weird thing with cardiovascular disease. So even though cardiovascular disease is the number one killer of men and women, a lot of women don't know that, but it's men and women, there is no standard screening besides lipid panels that you can get. There's no like, how we do colorectal screening with either a colonoscopy or a blood stool test, blood in your stool test, or for breast cancer, we have screening mammograms. There is no screening test for cardiovascular disease. So again, that, people walk around with plaque they don't know they have, or high cholesterol they don't know they have. So again, sort of changing the focus to be more aware of the fact that we can prevent cardiovascular disease. It's not all genetic. In fact, they say that only like around 20% of cardiovascular disease is your genes. The rest is these epigenetic factors, these other lifestyle factors, right? And those are the things we can control.
I agree. Which is great. I've been doing a lot of the things that you've mentioned that people should be doing. So that feels wonderful. One of the things that I was most curious about is exercise and preventing heart disease. I know that there's recommendations out there, and they vary drastically. Like there's some recommendations that say like 10 minutes once a day, and then there's some that are like 60 minutes of vigorous exercise 5 days a week. Do you have any updated information on where that lands about how much we should be moving in order to keep our hearts healthy?
Right. So this is one of those, it's not really controversial, but you hear different recommendations, right? And it gets confusing. Mm-hmm. So I like to keep things simple, right? Because I think the simpler that you can convey these things to people, the better it lands, right? So the American Heart Association recommends 150 minutes of moderate intensity aerobic exercise a week. Okay. So that's over your week, however you want to do it. Women, especially, we also need some strength training for our bones and our muscles, mm-hmm. right? But it's interesting. Have you heard of blue zones? The blue zones?
Yeah, very familiar with those.
So blue zones, they tend to exercise more just active movement, right? Gardening, going for a walk around the neighborhood, housework, cleaning the gutter, So So I always tell people the best exercise is whatever exercise you're going to do, right? So if you're not someone who likes to go to the gym, I don't want that to be the impediment to you moving more, right? So if you don't like to go to the gym or you don't like to walk on a treadmill, go for a walk outside. Nature's great, right? It helps our mood. There's a lot of data on that. So whatever, and even if you don't like to exercise at all, do something that's not exercise. Vacuum your floor every day or mop something, right? Something to get you moving. Because it's good for your heart, it's good for your lungs, it's good for your brain, right? There's a lot of data on brain health and exercise. One of the best things you can do for your brain. Stress management, again, it's good for that. So it has a lot of other benefits. So just move more. And plus, in today's culture and society, we spend a lot of time sitting, right? We're sitting right now. So it's just our life these days. So we just need to make an effort to move more.
I like that you basically hit the nail on the head for me anyway. It's about finding enjoyment in something, because I know myself well enough now that I can't make myself do anything I don't want to do. And I run a lot, but when people are asking me like, how do you go and run like a 10K every other day? And I'm like, I genuinely love it. And they're like, I hate running. I'm like, well, running is not for you. Go find something else that brings you the same level of joy. I get runner's high. So for me, it's like the most natural thing I can do for like my endorphins. I get a huge rush and I'm high on life. Like I said earlier, I went for a run before this podcast because it just gets me fired up. So I do have a couple questions. I would like to go down a small rabbit hole with you about exercise. Just because I've noticed, and this is just me speaking as Elisa, I've noticed how much my heart rate changes seasonally. So where I live, we get, typically it's beautiful. This winter, it's very sunny and very mild, but typically we get a ton of snow. And so my regular activities, I'm an avid mountain biker, love running, I rollerblade, I walk my dog, like I basically live outside. But a lot of those activities go by the wayside simply because we can't do them in the winter. And I do an activity in the winter, I snowmobile, which is very active because they're large machines. But I notice the trend in my heart rate from my wearables changes around like 8 to 10 beats a minute, depending on like my resting heart rate from the summer to the winter.
So it goes up or down which season?
In the summer, it goes down quite a bit. So it'll be like 55 beats a minute in the winter, and then like 45 in the summer, probably because I'm doing hours of exercise. Is that to have that kind of change every year, basically, is that healthy, or should I be trying to keep that up? Because I don't ever want to run on a treadmill. Like, I'm just not someone that's going to do those things inside.
Right. So I would say so what you're noticing, so the more fit we are, the better cardiovascular fitness we have, the lower our resting heart rate typically.
Yes.
Right. And so that's what you notice in the summer. When you're more fit and more active, your resting heart rate is lower. So that makes sense.
It's just so drastic.
And then well, it seems drastic to you, but it's not really that drastic. I mean, it's low. Both seasons, it's low, because 55 as your resting heart rate, that's low too. But it's just lower when you're fitter, is how I would explain it. But it's not dangerous or concerning or really even. It's just interesting that you can see that, right? So another thing you've noticed by your wearables.
Yeah, it's actually pretty interesting at my fittest, because I do run quite a bit. At my fittest, my resting heart rate can be like 37 to 39 beats a minute, and I go to the doctors for something, and they're like, this is really low. And I'm like, I do a lot of cardio. And they're like, oh, okay, that's fine. That makes sense. And I'm like, ooh, should I be worried? So, that's great.
It's just your heart is healthy. So that's good.
So what happens with that? I think I know, but if I'm wrong, I'd love to be corrected. So does your heart muscle become more efficient, so it's pumping the same amount of blood with less beats? Or what does a lower heart rate actually mean from a physiological standpoint?
Right. So so your heart is more efficient. Your cardiac output, meaning the output of your heart, it doesn't need as much. It has to do with your heart rate and your blood pressure, and when your heart is in better shape, it can do that with a lower resting heart rate. Yeah,
amazing.
Now the other bit of that is heart rate recovery time, right? So people who are more fit and more active and have better cardiovascular fitness, usually they're when they stop exercising, their heart rate recovers very quickly, right? Whereas someone who's maybe not in as good of shape, it takes them longer to recover. And it's interesting, that's one of the things that we see post-COVID infection. People's resting heart rates go up, and it takes longer for them to recover. And their resting heart rate, they can have palpitations and arrhythmias, and it bothers them. Sometimes it takes several months to kind of get back to normal.
It's so interesting that you say that, because I had a very bad mountain biking crash in the fall. I ended up unconscious, basically. So I'm assuming I had a concussion. I went to the doctor, and I'm not sure if there's something in the United States that is better for like understanding like what level of concussion is. But typically, like the doctor I saw in Emerge was like, well, if you were unconscious, you probably have a concussion. And I've had other ones. And one of the things that was most startling for me was my resting heart rate for months was higher than normal. And once again, like this wearable technology that we have, I was like it was really crazy to me that a head injury, and this is just me playing around with my own data because I'm a huge data nerd. You know, I'm not diagnosing other people with concussions or anything, but I was just really surprised that it took up until 2 weeks ago for my heart rate to become normal after having a concussion. Yeah. I was like, wow, there is a strong correlation between all parts of our body and that kind of thing.
That's right. So, yeah, that is interesting that you saw that. But we do know people who have strokes can have changes on their EKG, the heart tracing that we do. So yeah, it's all connected. That's the point, isn't it?
It is. And doing one thing that's good for your heart is probably good for your brain and other organs and everything. So it's one piece of the puzzle.
Right.
What kind of dietary changes, habits should people be making in order to have a healthy heart? Obviously, we spoke about exercise. From a diet perspective, are there certain nutrients people should be paying attention to, or even like bigger picture kind of foods that you recommend people consume?
Yeah, so this is bigger picture, and it's probably the best thing that you can do for your heart is follow a whole food plant-based diet. So there's a ton of data that eating animals and animal products is not good for it's not good for your cardiovascular system. It's not good for your gut. It's not good for your brain. It's not good for autoimmune diseases. So that's the diet that I coax people to try to move toward, whole food plant-based diet. So that's no animals or animal products. So people always think it's red meat that causes heart problem. Right? Well, most Americans get most of their cholesterol from chicken because we eat so much chicken, right? So by volume, chicken is a problem. Eggs and dairy, cheese. Cheese is high in sodium. They're all high in fat. So if I could get one person listening to become a champion of a plant-based diet, then this would be a success for me.
I love that.
But it's diet is hard. Again, it's a lifestyle change and a habit that's hard for people to do because they've been eating certain things their whole life. There's a lot of, social activities are around eating, family things are around food. It's hard to go out to dinner when you're following a plant-based diet. It can be done, but it's more work, right? It's all more work. But there's a lot of data, and I can share some resources with people listening, good data on the health benefits of a plant-based diet. So I tell my patients and clients to start slow. First I tell them to be more mindful of what they're eating. Right? Because sometimes we just eat stuff because it's here or drive through and we're eating it and we're not even really thinking about what we're eating, right? So be more mindful of what you're putting in your body. So if your body is a temple, right, we want to treat it with respect, right? This is it. We get one body. We need to take care of it. We need to treat it with respect. We need to remember all the amazing things it does right? It's the most amazing machine ever invented. And you wouldn't put water in your gas tank, right? You put the best fuel you can find. So it's the same thing with our body. So the first step is to be more mindful of what we're eating and drinking. So next time you're going to eat or drink something, just take 10 seconds and think about it. Is this going to help me or not? Right? So if it's a big gulp, the answer is no. It's not going to help me, right? So, maybe I should have some tea instead or a glass of water. So just start thinking about it from that aspect. I think it'll kind of change the way you look at food, right? So then once you start thinking about it like that, so then maybe you're ready to kind of go the next step. So the next step would be start experimenting with with leaving the meat out, right? So instead of, the World Health Organization classifies processed meat, so deli ham, sausage, hot dogs, bacon, as a group 1 carcinogen. Those cause cancer at the same rates as tobacco and asbestos, right? So people don't really talk about that, right? But a lot of people have a ham and cheese sandwich every day for lunch. Well, if you know that deli ham is a group 1 carcinogen, is that good to put in your mouth? No, it's not. You would never, So when you're making your daughter a ham and cheese sandwich, it'll make it, is this the best? Do I want to do this? Right? So then maybe instead of your ham and cheese sandwich, you do some avocado toast or hummus on whole wheat toast or hummus and carrots, right? So it just makes you start thinking about things in a little different way. So instead of your maybe it's Taco Tuesday. Instead of putting ground beef or chicken in your tacos, you have brown rice and beans. You leave out, or do a plant-based meat. And people say, oh, well, that's processed. Yes, but it's better than meat, right? So again, there are stages of change, right? So if you don't want or don't think you can tomorrow become a plant-based eater, start slow and make gradual changes. You'll feel better, you'll lose weight, and you'll keep the weight off. The inflammation in your body falls, your head clears, you'll feel better, and you'll want to eat more of that way, right? Because you're like, oh, I don't need all that meat. I can get protein from plants. More fiber. Now I'm having these awesome regular bowel movements, right? So it's just one thing after another, and it makes you appreciate the good things you're doing for your body. So if there's one thing that people can do to prevent heart disease and also keep their brain healthy and their gut healthy and lower some risk of cancers, it would be to move toward a plant-based diet.
I love the mindfulness piece too, of just about thinking what you're putting in your body. I don't think many of us do. I know I have moments where I do, but I'm absolutely guilty of that too. Like
Sure.
I also believe that food is one of life's greatest pleasures. So if my mom makes an absolutely deadly pie, and I'm never going to say no to that pie.
Well,
So there is something to be said for that as well. But day to day, every day, I don't really know if I'm sitting down and I'm thinking,
right.
Is this helping my health? Is this hindering my health at every meal? And I think when you said like we only do get one body, I think that a lot of people, and I've fallen victim to this as well, you don't really appreciate how valuable your health is until you have an event that startles you into, like, either you have, some kind of crash or accident like I did in the fall. And I was like, whoa, like, I feel terrible right now.
Right.
And it's like, I need to actually really take care of myself. And I know that people, obviously I've have lost people to cancer and all those kinds of things. And they're like, I wish that I'd taken better care of myself. And I just don't really think that I think we often take our bodies for granted until something happens. And then we're, the saying, I've said it on the podcast before, but an ounce of prevention is worth a pound of cure. And I truly believe that. And so for me, I've tracked my nutrition every day for the last 6 years. Part of that is my job. A part of it is I just want to be on top of what I'm putting in my body. But after this conversation, I think I'm going to take a deeper look and just maybe become a little bit more mindful about things. I definitely think that there's substitutions that can be made. Like I make a taco bowl with tofu, and at first people are like, that sounds disgusting, and I'm like, no, you should try it. It's actually really great. You can just like crumble tofu and make a taco bowl, and I think it's really delicious. So yeah.
But I think, again, in today's society, we don't, we're all so busy and, it takes time to plan healthy meals, and you got to go to the grocery store and you got to cook more from home. And it just seems overwhelming, right? So I think that's part of the problem. And we just tend to think, well, I'm just eating my normal stuff. But stop and think about what that stuff is, right?
I love that advice. There is so much convenience. I know a lot of people, like, I live in a small town, and the fast food options here are plentiful. Like there is, there's just so many options to just swing through the drive-through when you're hungry, and it does take more effort to make a meal. But I actually, the times that I do cook, I'm like, this is a lovely experience, and sitting down, and it's very rewarding, I think, to eat with your loved ones over something you prepared. outside of exercise and diet, can we talk a little bit about the implications of stress and heart disease?
Yes.
What do we know about the correlation between stress? And there's two different kinds of stress, right? Distress, which is negative, and is it eustress, which is considered a positive stress? Is that right?
Yeah, I'm not sure I know what context you're talking about. Like stress for, you mean like to get out of the way if we're getting ready to be in a car wreck?
I think just more like on your life, like work environment stress or familial stress. How do those things impact our health?
Right. So, yeah, that's a huge thing as well. And a lot of interesting research coming out about how stress impacts our health in general, not just our heart health, but again, health in general. You know, evolutionarily, right, stress keeps us from getting eaten by the saber-toothed tiger, right, or whatever, right? It's a protective mechanism to keep us alive. Well, humans evolved in small groups, hunter-gatherer groups, and that was it. We lived to be 30 if we were lucky, right?
I would have been gone.
Yes, right. And we were just trying to survive from one day to the next. So now here we are in this world where we can get on our phone and know about some tragedy that's happening thousands of miles away. So we got to process that. We got to look at this. We got work. We got kids. We got, it's stressful, right? Modern life is stressful. There's no doubt about it. So stress takes a toll on our body. That chronic stress, stress hormones, adrenaline, cortisol. When we're under this chronic stress, those hormone levels go up. That causes, again, inflammation in the body, which is tied to heart disease, gut disease, brain problems. So again, it's all related, right? So we have to, again, if we're going to put our body first now, right, we're going to change our thinking and our bodies first. We're going to focus on how to pay attention to our self-care, and which is part of stress management, right? Because we gotta take care of ourselves before we can take care of everybody else, right? So that's where things like meditation, mindfulness, journaling, talking to your friends, meeting your friends, going on a walk, all those, sitting in the hot tub or the sauna, taking a warm bath. All those things that, like, if you think of it, you're like, oh, that, getting a massage, all those things that are good for us, relax us, help us feel better. So we're going to, instead of those being the last things on the to-do list, right, we're going to pencil those in and structure the rest of our day around those things, right? So we're going to, you got to figure out how to do it, right? Do you get up 30 minutes earlier so you can meditate? Do you, go on a walk at lunch, journal when you get home from work? Just think about some different ways to incorporate these things. Put them on your calendar, on your schedule, however you have to do it to make it top of mind, right? So it's not an afterthought. Stress management and self-care is on the top of the list, not an afterthought.
Yes, self-care is not selfish, which is something that I think women in particular, I know some men too, but a lot of women struggle with that for sure. Yes. But I think that in order to give everyone the best of you, you really have to take care of yourself. So
yes,
that is very helpful. And I think that I'm going to be more mindful about my diet after this. And I'm going to book a massage because you just gave me the permission I needed to go get a rub done.
Yes, that's right.
One of the other things that's getting a lot more attention lately, and I love this, is sleep. I love sleep. And I am religious about my sleep hygiene. I think that that's the one thing that I'll always make sure that I do. Are you making recommendations in your practice as we learn more about the benefits of sleep for sleep hygiene and heart health?
Yes. Yeah, there's, again, a lot of data on the importance of sleep in the heart, sleep in the brain. There are certain sleep disorders like sleep apnea that can adversely affect the heart. So yes, sleep, again, it's one of the pillars of lifestyle medicine that is on the list to discuss with people. So, we need 7 to 9 hours of sleep. Average American does not get 7 to 9 hours of sleep a night, so we need to work on that. We need to, again, figure out how to get good sleep. So it's not just, okay, I'm going to sleep more. So how do we set that up to be, do we set it up to be successful at it, right? So in other words, I tell people to start backwards. So if I get up at 6 o'clock in the morning to meditate and, get breakfast ready for everybody and be at work by 9 or whatever. So if I get up at 6, so count backwards, that means I need to be asleep at 10, right? That's my 8 hours. Some people might be 7, some people 9, but say 8 hours, right? So we all need between 7 and 9 hours of sleep. So I need to be asleep by 10. So that means I have to start getting ready for sleep about 9, right? So you need to have a routine that you do, starting like an hour before you want to be asleep. So that's get rid of screens, no heavy meals, no alcohol, that disrupts your sleep, no smoking, don't watch some scary or stressful show at 9:30, right? Because then you're revved up. You're not getting in the mode of sleep, right? So you want your room to be cool and dark, and you want a bunch of comfy blankets and a comfortable bed. And if you don't want any pets in there, right? You want it sleeping oasis, right? And you don't want a TV in the bedroom. All you do is go in your bedroom and you get in bed and you're cozy. You might read a book because that's not a screen, but that helps kind of most people helps them wind down. Or you could listen to, there are a lot of like calming apps, my son listens to one of those, just kind of gets him relaxed. So then by 10, you're sleepy. And then you go to sleep at 10 and you wake up 6, right? And if you do that long enough, it's just like when we're teaching our kids how to, when we're sleep training our kids, right? I mean, you don't play with your kids and bounce them up and down and then throw them in the bed and say, all right, go to sleep, right? It's the same thing. Our bodies need a wind down process, and you do the same thing you brush your teeth and you wash your face or maybe take a warm shower. That tells your brain, okay, it's time for me to start winding down and getting ready for sleep. And if you do that, you will be able to sleep like a baby.
Agree.
And it's good. It's great for your heart and it's great for your brain. It's great for stress.
I actually noticed because one of the things I pay the most attention to is my heart rate during sleep. And I have made changes based on what my wearable technology is telling me. I did notice if I would go for a run after 3 p.m., in the day, which is typically when I had the most energy. So I'd get the fastest run times, but my heart rate would be higher at night than if I ran before 3 p.m. And the same thing with meals. If I have like full on dinner, or I'm so sensitive to caffeine now. I didn't used to be, but if I have caffeine, basically anytime after like 1 p.m., I'm pretty much done. And I think that those are just things that people can just learn about themselves, because I know a lot of people who can have a coffee before bed and go to sleep. And I'm like, that is so impressive. I think sleep is highly, personal. And I think that a lot of people can use the technology available or even just go off how they feel. But I know that for me, the technology that I use made things very clear to me. I don't drink alcohol, but like we were talking earlier, people were noticing how much higher their heart rate was for days, actually. So I think that that's super interesting as well.
The other thing I want to mention, though, when you say like people can drink caffeine late and sleep fine, they may be asleep, but is it restorative sleep, right? So that's the other thing to remember. Like people who drink alcohol before they go to sleep, they may be asleep, but they don't have deep restful sleep. It affects their REM sleep. So they may not be getting restorative sleep. So just something else to think about.
Yeah, that was actually a point that was brought up we interviewed a sleep expert as well. And a lot of people, I think, will drink alcohol because it helps them go to sleep faster. And they're like, oh, well, I mean, I'm getting better sleep because I'm falling asleep faster. And it's like, actually, what is happening is you're not getting any of the true benefits that come from sleep, which is found in the deep restorative sleep. So I think that that's an interesting misconception that's out there that I was happy to have debunked. I sent that episode to a bunch of my friends who said that. Honestly, that's one of the best parts of my job is I get to talk to all these professionals that know way more than I do. And I'm like, people are like, oh, there's no difference eating a protein shake at 11 p.m. And I'm like, from like a nutrition standpoint, no, but from a sleep standpoint, yes, there can be. So it's been, I basically just get a front row seat to helping give advice to my friends and family.
Whether they want it or not.
Yeah, 100%. That's my job. That's what I'm going to do. You've obviously been in the industry and been a cardiologist for a very long time. And I think that having your level of expertise in an interview is incredible. I'm curious to know if there's anything that you've been surprised about recently when we're talking about advancements in healthcare for cardiology. Is there anything over the last couple of years you've been like, whoa, this is exciting?
Well, yeah, I mean, the treatment of cardiovascular disease is amazing, right? I mean, we can fix people's heart valves through the leg. We can treat their heart attacks by opening arteries going through the wrist. So the treatment of a heart problem is state of the art, best in the world, right? But again, I think because despite, the healthcare system in the United States, despite being spending more money per capita than any country in the world, we don't have the best outcomes. So despite all these amazing things we can do for heart disease and cancer and, you name any disease, we still don't have the best outcomes. So, why is that? Well, I think it's because our healthcare system, we're very good at treating problems, right? But we're not as good as preventing the problem.
Agree.
And I think there are a lot of reasons for that. Our health insurance system isn't set up for prevention. We have big pharma that makes money by giving people pills, selling pills. We have big agriculture that puts a lot of money into lobbying and giving money to the American Heart Association and the American Cancer Society, and so there are a lot of competing factors. So it's my hope that's going to be the next thing on the horizon, is that everyone realizes that the best way to stay healthy is to take care of my body. And the best way to take care of my body is the old-fashioned things, whole food, plant-based diet, move more, stress management, good sleep, social connection, and avoiding risky substances. So that's where I hope the next horizon is that people realize how important that is.
I think that I mean, obviously I agree with you 100%. And that's kind of our ethos at Cronometer too. We do want people to make the most informed decisions. Hopefully, best case scenario, people are understanding their diets and what they're putting in their body, and then therefore making decisions that could greatly impact their future. Whenever I see, like I bought my Apple Watch, it was $1,000. And I think for the price, I'm like, what I've learned about my health for me is invaluable. But It is unfortunate, and I hope that it kind of goes the other way, that it would be amazing, and I know it's like a pie in the sky dream, but if insurance companies and that kind of thing provided these tools beforehand, because I know I forget the numbers I've heard, but how many thousands and thousands of dollars it costs when someone gets an illness. It would be amazing if these tools were readily available to everybody, and then the health benefits we would see in prevention. Because I think $1,000 when I bought my watch at the time, I'm like, oh, that's a lot of money. But now I'm like, what it has done for my health is invaluable to me, and the insights I understand about my body, it's invaluable. And I just wish everyone had the same level of access to things that can teach them more. And I know I am going to shout out the company that I work for sure, because we give out all of the nutrition data to all of our free users. You don't have to pay a lot of the apps that are in the same market as us, the nutrition tracking apps. You have to pay, $20 a month, $15 a month to upgrade to that data. But we just think that it should be accessible to everyone regardless of their budget. And I wish that the same was true for other things like testing cholesterol and those kinds of things, that we could spend more money on the front end than on the back end. So
right.
You've been a wealth of knowledge, and I think that you've made cardiovascular disease interesting. We talked last time when we met. I was like, heart health is not like necessarily the sexiest thing, but I think that you are so charismatic that it definitely livens things up, and I appreciate you sharing your knowledge with us. I always end the podcast. You've given us some actionable items already, but I always end the podcast asking if there was one thing that our listeners could do today, in your opinion, that would improve their health. What would it be?
And you know what I'm going to say, right? No meat for dinner tonight. Try it.
I thought that might be your recommendation. Dr. Paeschke, it's been amazing to have you here. Thank you so much for being so generous with your time. If people want to work with you, because you did say that you have an online practice, can you tell people where to find you? And then we'll link it in the show notes as well. But where can people listening hunt you down?
So my website is www.hearthealth.care.
Perfect. Do you have any social handles or anything?
Yeah.
Okay.
So I'm on most active on Facebook and LinkedIn. Okay. You can find me there.
We will include those as well. Thank you so much for being here. You've been a wonderful guest, and I really appreciate your time.
Thank you.
Take care.
Bye-bye.
Bye.
Bye.
Like we said in the podcast, heart health might not be the sexiest topic, but it's something that everyone should be focusing on now because ultimately we all want to live long, healthy lives. And heart health, as Dr. Paeschke said, is the #1 killer. So we hope that you learned a lot about your own heart health and the things that you can do to improve yours today. If you like this episode, please make sure that you refer it to anyone else that might find it interesting. And please subscribe to Discovering Nutrition. Until next time.